has TONGKAT ALI that relieves stress and anxiety. It boosts the stamina and the drive and increase the levels of free testosterone. Also, it helps in prolonging the erection in men. ALTA Ultima muna po tayo. Okay, so since I'm an anti-aging practitioner, and of course I do aesthetic as well, most of my patients really are geared towards this. Okay, kahit naman sabihin na natin na talagang yung iba ayaw nilang isipin na tumatanda sila or talagang nararamdaman na nila ang mga simptoma ng pagtanda. They would always say na hindi, it's just a number. But then of course, you would see and feel that definitely there is symptomatologies that you would have to be really looking into because you're already aging. Okay, young, okay, there's always a standard to being young. And one of course, the most obvious indicator na tinitignan natin that you are youthful, of course, is your skin. Without you telling the age, no, makikita mo na kung more or less anong dekada na itong taong ito, no? And you are being judged as according to your skin. So yun yon. Young skin is our first line of protection from the environment. So we have a lot of stressors or insults from the environment, and the skin is the one that is protecting us from all the harsh and harmful chemicals that are actually constantly bombarding and of course attacking us. Okay, we're constantly exposed to a lot of this. It helps us also regulate the body temperature. When it's cold, then it actually tries to control the temperature so that you won't feel cold. We have the three layers of the skin, and we have the epidermis, the dermis, and the hypodermis. Okay, so this is how a young looking skin would look like. Okay, so see, we have in anti-aging a triangle on the face that we look into to see if whether okay a person is already aged. Okay, see the skin, of course it's so smooth, unblemished, okay, tight and taut, okay, and then of course everything in proportion. This is actually a very good model of very young skin. Okay, but then of course as we age, okay, we have the reversal of the triangle when that actually you have the point actually here, and then of course reversal of the triangle with a lot of wrinkles, furrows, depressions, a lot of your crow's feet, and then of course sagging eyelids, lower lids, and then of course you have your nasolabial folds that is actually depressed and then sunken, and then of course you have your jowls and all this sagging skin. Okay, this is a depiction of an old skin. Okay, so what happens? Okay, why do we have aging skin? Of course, we are constantly being exposed to sun and its radiation. So that causes us sun damage. Especially happens to the most exposed part. Say, for example, when you're driving, diba? The side that is constantly kissed by the sun is the one that causes a lot of depletion. No, a lot of our collagens are actually depleted, and elastins also go down. The skin would sag and have a lot of furrows, wrinkles, and of course, it will also go down. So, yan po yung sun damage effect. Okay? So, there are actually remedies that we can do. No? So we have this as the solution to actually preventing this sun damage. Of course, we would always be using an umbrella. So we're the only country that, constantly would have, umbrella. And then of course, amongst the other Asian countries, no? Kasi mas matindi ang sikat ng araw sa ating bansa, sa Pilipinas. So you can use umbrella. Apply the sunscreen every hour when you are exposed to the sun. When you would go to the beach, at least an hour before you can plunge onto the water. Choose the timing of your sun exposure. not beyond 9 o'clock, or actually sabi nga nila talagang mas matindi pag 10 o'clock hanggang 3 o'clock. So apart from the sun damage is the dehydration. So notice that you have a skin here that nagbibitak-bitak, or parang of course you have like parchments, okay? So yan yung mga dehydrated. So what causes the dehydration? Also sun exposure. So what, and also extremes of weather, when it's too hot or too cold, okay, so that causes the skin to be dehydrated. Then inadequate fluid intake. Of course, we are asked to be taking at least 8 glasses of water. I was pertaining to the number of sleep now. Actually, 8 glasses of water on a regular normal day. But should it be like summer, okay, so dapat mas madami, unless you have some congestion problem, or say may mga edema problem that has to be really moderated, okay? So inadequate fluid intake, also physical exertion. Too much of physical exertion, going beyond at least 2 to 3 hours of exercise with just in a day, say for example, that makes you sweat a lot. Okay? And then certain medications that would cause you diuresing, meaning iihi ka ng iihi. Now, so what is our solution to that? Okay, so you have to minimize unnecessary sun exposure so that you won't be dehydrated. Drink plenty of water and fluids. Have water-rich fruits and vegetables. Avoid diuretics. Okay, so yung mga alcohol, these are diuretics. So coffee, no? And then of course tea. No, these are all diuretics. So you've noticed that okay, ihi ka ng ihi after you go into say a certain coffee, and then of course, or say a certain tea, and then of course we have alcohol drinkers that would go and pee every time because they are actually diuresing. So that actually causes their skin to be dehydrated. So if you have malnutrition, okay, you will always see them having uneven skin tone. The texture is bumpy. It's kind of, there are a lot of these papules, okay? So yung mga butlig-butlig and all that. So, and then sometimes you would mistake it for some acne or back knee. So that's actually a sign that you are actually not nourished, okay? So undernourished, okay? Also, you have dryness and itchiness and flaking of the skin. There will be some hair loss also. So sometimes it's not because of the shampoo. So sometimes because the person is not really nourished well. That's why, okay, the skin is actually losing. Of course, you have to rule out if there is really a family history of hair thinning and hair loss. No? So yun yung mga potentials for that. But then, when, okay, a certain patient is really so slim, so svelte, and very, very sleek, no? Sobrang payat. And then, of course, very lethargic, mabagal, or medyo mahina. Of course, that could be a sign of malnutrition. And then, of course, there will be some wounds that are not actually healing so well or so fast. So that could be a sign that the patient is really malnourished. Okay, so what are the causes? Poor diet. So definitely those that cannot really be affording a good nutrition, okay, they have a poor diet, okay, poor digestion and or absorption. So may mga problems sa GI tract nila or sa mga intestines, may mga ulcers and all that. Bad lifestyle. Okay, so those who are in the fad, okay, of say for example a diet trend, or say for example those who are into vices, okay, then that could cause you some malnutrition, and certain other diseases that could actually cause you some malabsorption and malnutrition, meaning hindi na-absorb yung mga nutrition sa ating katawan. Okay, so what are the solutions to malnutrition? Let's eat healthy. Okay, improve your digestion, have a healthy lifestyle, and consider your supplementation. Collagen is actually a strong and tensile structure that holds everything under our skin. It's not just in skin, but also it can be found in the hair. That's why may mga hair collagen replacements or supplements. So it's not only for the nails, no? It's not only for the skin, but also for the internal organs, the heart, the every single visceral organ. And then, of course, it can be found in your cartilage, your ligaments, your tendons, bone, and teeth. So, hindi lang po sa skin may collagen. It is responsible for the strength of the skin and its elasticity together with the elastin. Okay? The deficiency could lead to wrinkling. No? Pag wala ka na or nag-deplete ng collagen as we age, okay, it could cause you the deepening of the lines or the furrows or the ridges or the furrows na tinatawag, no? And then of course, it can cause you wrinkles, fine lines and all that, and of course, premature aging. Where do we source collagen? Of course, there's a complete line of this in the fatty fish. Okay, so of course, if we are going to feed, rather eat or feast on, okay, salmon, say for example, for omega-3 and all that, it is a very good source of collagen as well. Okay, in some meats, it can be sourced from chicken, from pork and beef. Then, of course, but there's actually the question of the amount and the cholesterol that is actually embedded amongst these meat, especially if it's a red meat. So that's another story. We have, apart from collagen, we have the CoQ10, okay, which is actually produced in the body but may be also obtained from food. They can actually be sourced out in every cell from the mitochondria, which is the powerhouse of the cell. So it's the one that actually produces your energy. No, that's why it's for energy production. So it has antioxidant functions like your vitamin C, your vitamin E, and it reduces your sun damage, okay, or skin damage, okay? And it also decreases with age. So meaning at age like 25 to 30, then you can actually be having some depletions of your CoQ10, just like with your collagen. Now, where do we source CoQ10? These can be sourced from organ meats. For those who don't have problems with your uric, okay, then you might just be eating that, okay? Muscle meats, of course, and then of course fatty fish, vegetables like spinach, your cauliflower, your broccoli, also your citrus fruits. Of course, one that contributes to your skin's rehydration or the youthfulness of the skin could be your hyaluronic acid. Okay, so it binds with the skin protein. Knowing that a lot of proteins are in the skin from the dermis. Okay, so it binds with the proteins, also with the collagen and the elastin that makes it actually so tight and hydrated. Okay, so medyo parang plump yung skin. Okay, it binds the water to keep the skin hydrated and moisturized, and it keeps the skin wrinkle free and prevents the premature aging. Okay, and decreases with age also. So that's why we have to outsource hyaluronic acid through supplementation. Where do we source hyaluronic acid? It can be sourced from pinakulaang mga buto-buto, okay, bone broth, okay, soy-based food, root vegetables, green leafy vegetables. Okay, so these could be one of our armamentarium. Okay, so yung collagen, yung HA, and then of course yung ating CoQ10 for our skin to actually maintain its youthfulness. And then of course, we also have what we call as the antioxidants. We know that the antioxidants are very powerful in protecting the cell from the oxidative stress. When we say oxidative stress, this is actually a reaction brought about by our free radicals, no? And this has to be neutralized kasi yung ating see this structure, the green one is a stable molecule inside our cell. But then, of course, once you are actually exposed to a lot of free radicals that we have in the environment, this doesn't have a stable molecule and it lacks one. So what does it do is that it will try to pair with a stable molecule and rub off these one molecule. So, and then of course, siya yung medyo maintained or balanced na But the other one will become another free radical, meaning it will die certainly after a molecule has been grabbed from that particular cell. So what does an antioxidant do? Instead of the cell doing its function in actually pairing it and completing this free radical, the antioxidant will just do and donate it to the free radical or to the unpaired electron and then becoming a stable cell again. So that's actually the role of the antioxidant in our body. So less free radicals, okay, then of course you won't go into oxidative stress. You don't go into um, cell death or apoptosis later on. Where do we source all these antioxidants? Basically, we source it a lot from fruits, vegetables, okay? But then of course, what are the purposes of all this in our life? Okay, we wanted to be youthful, young looking skin and all that radiant, and of course we have to maintain our vitality and virility when when all these things cannot be used if and when, say for example, you are not useful. Hindi, meaning you cannot be using your youthfulness, your glow, and then of course, at night, you're not able to sustain what is needed, as a couple. Now, if your body, your skin, and your totality is just for display only. So what's the essence? Okay, what is it for? Okay, now let me just lead you to our topic proper. Okay, that was just my prelude. Okay, so the prevalence of sexual dysfunction amongst male and female. So of course, there's a great majority nowadays, okay, that are actually having problems in terms of sexual functioning. So there's the dysfunction. So the great majority in males, okay, would have erectile dysfunction. So 33% would have, okay, erectile dysfunction. Ano po ba yung erectile dysfunction? It's the inability to get or to keep an erection. Meaning, ang pagpapatayo pa lang ay medyo hirap na, and or kung tumayo man siya, hindi siya masustain hanggang sa huling action. Kumbaga, it's not actually sustained. Okay? And then it's not able to complete the sexual intercourse satisfactorily. So, nandun pa lang, umpisa pa lang, okay, medyo nagka-problema na or minsan nagkakaroon pa ng premature ejaculation. So then of course, that actually messes it up. Okay, so medyo malaki pong problema or porsyento yan amongst the male, and males do not really talk about that. Okay, syempre, ang mga males feeling macho, so hindi nila sinasabi yan, not even to their partners. Minsan, sinasabi na lang nila through other actions or minsan nagagalit-galitan or because of they're too preoccupied with that problem, they would actually address it into something else, or they don't really want to talk about it. But let me just tell you where the root is coming from, where the root of all these dysfunctions are coming from. Okay, so we know that the estrogen for the female and even males would have estrogen, and especially heightened at the adolescent, and then of course during the early adult stage, no? So ano ba yung function ng estrogen? So it stimulates the choline acetyltransferase, which is actually the one that prevents us from having Alzheimer's. So definitely once you have Alzheimer's, there's nothing really that would stimulate you or arouse you, not even nagpakita yung asawa or yung partner. Of course, demented, wala na, of course, neurotransmitter that would sense, hey, kailangan kang maging malibog or malilibugan ka. No, there is no such thing anymore. But then, of course, estrogen, once depleted, wala na. And then, of course, that could cause you Alzheimer's. And then increasing metabolic rate, okay? Normally, when you are at the height, okay, your metabolic rate is also increased. But once you actually age, okay, the metabolic rate decreases. So ano yung mangyayari? Ayan yung pagtaba at paglaki ng mga katawan. And then of course, a lot of mga complications due to the the decrease in the metabolic rate. But since you have, okay, also improves your insulin sensitivity. At an early age, okay, you have a very good insulin able to digest everything that you have ingested. Pero ngayon, as we age, okay, so bumababa ang insulin activity and sensitivity that actually makes you go into diabetes and a lot of its complications. Also, when you have estrogen, as mentioned, it regulates your body temperature when you are actually feeling hot or feeling cold, also preventing muscle damage. So when even your muscles become damaged, kapag may estrogen, okay, it actually makes your muscle go into its reparative state, nagre-repair. Okay? Also, maintaining muscle and improving sleep. That's why when your estrogen goes down, when especially you are menopause, di ba po, yung ang inyong pagtulog ay medyo nagkakaroon po ng epekto. No? So nagkakaroon po ng change of the pattern of yung sleep and even inducing sleep. Yung iba nagkaka-insomnia. Okay? So, also, when you have estrogen, it reduces the risk of cataracts. Okay? But of course, when you undergo menopause, okay, dyan na nag-i-increase ang potential for cataracts. Okay, it maintains the elasticity of the arteries. Okay, pag pag dumadaloy po ang mga ang dugo sa ating mga arteries po, of course, it actually has to be stretched. So kailangan pag na-stretch po siya, yung kailangan yung elasticity niya is very good to accommodate the blood flow. But then of course, as we age, with the increase in the deposits there of fats and plaques no, sa mga arteries, lumiliit po yan, parang yung mga tubo ng mga gripo natin, oo, na nagkakaroon ng kalawang, lumiliit po ang kanyang lumen o yung butas na daluyan, kaya nagkakaproblema po dyan sa mga arteries. Okay. Also, pag sa estrogen, well, of course, it dilates, no? Pinapaluwag niya po ang mga arteries, and then, of course, increasing the blood flow. It inhibits the platelet stickiness, no? So, hindi niya pinagkukumpul-kumpul yung mga platelets that would be later on causing some obstruction sa mga blood vessels. It decreases the accumulations of the plaques in the arteries, the same, okay, and enhances the magnesium uptake and utilization. And then, of course, yung ating maintenance of the collagen in the skin are all brought about by our estrogen. So, it decreases the BP. So, usually, pag nag-menopause, tumataas din po ang mga blood pressure kasi hindi na nga po nagdadilate na maganda ang mga blood vessel. Of course, yung LDL po, na which is a bad cholesterol, it is being decreased by the estrogen. But of course, when you go into menopause, it actually increases, and worse if it gets oxidized. No? So medyo hindi po maganda yan. Also, estrogen could help you maintain your memory. It increases your reasoning and new ideas. Also, fine motor skills. Di ba yung dati nakakapagsulsik ka or nakakapag-crochet and all that. Now, as you age, yung mga kamay ninyo nahihirapan na rin together with the estrogen depletion. So, you're not able to do your fine motor skills. Lahat pong ito mawawala kapag wala ka ng estrogen or nag-menopause. Or even prior to menopause, you will already be experiencing some of it due to the decrease of your estrogen. Okay? What happens when you have a testosterone loss? So, okay, magkakaroon ka ng wasting. Muscle is wasted. Kung dati bukol-bukol yung mga muscle mo sa pecs mo, sa biceps, sa triceps mo, sa abs mo, okay, wala na yan. Nawawala yan, napapalitan ng fats. Okay? Weight gain also. So you have fatigue, low self-esteem, you decrease your HDL, which is a good cholesterol. So it's being replaced by LDL. You have a dry, thin skin with poor elasticity. So dati, pag pininch ka, okay, bumabalik lang, may instant recoil yung iyong skin. Ngayon, pag hinila ka, hindi mo na alam kung babalik pa yung skin kasi it's already sagging. Okay, so, and then you have a thinning and dry hair. You have a droopy eyelid. So, And then of course, you have a sagging cheeks, a thin lips, and anxiety. So kaya nga po, even males, no, nagpapa-inject po ng mga fillers for their lips kasi pag nakita nila na ang kanilang lips are medyo thin na, that's already a sign of aging or when you have already depleted your testosterone and even estrogen for the female. And then of course, they become anxious, no? So medyo they're so irritable and angry every time. So they're easily agitated. What are the causes of testosterone loss? Andropause is one. Okay, and then of course, it's actually 1% annual decline after the age of 30. So at the start of age 30, that actually causes you to go into andropause yearly by 1%. And then of course, for those who underwent chemotherapy, then you can have total loss of your testosterone until can be actually reverting, no, but that's slow pace. Adrenal stress or burnout. So stress is not really good because if a testosterone goes down, okay, even when you know it, okay, hindi ka pa nakakaano, wala ka ng testosterone. Okay, depression also, psychological trauma, and those who are taking some statins to actually lower the cholesterol level. Okay, the prevalence is actually at 20% in men aged 60 to 69, and then of course 50% in men older than 80%, of course. So now, as mentioned, we have the yung erectile dysfunction. It's not just the only problem amongst males, but then it's actually lumped into all the sexual dysfunctions in males. So when we say erectile dysfunction, it's the difficulty getting and keeping an erection. So we have others like, okay, premature ejaculation that comes next to it. And then of course, delayed or we have the delayed or inhibited ejaculation, and of course, the low libido. But of course, it's up for us to be just talking about erectile dysfunction. Now, it's the inability to keep an erection for the intercourse, for the entire duration of the intercourse. It's common, and there's about half of the American men over age 40, ang babata, no? They are affected. And of course, they can be actually attributed to the disease affecting the blood flow, no? Because the arteries po ay nagtigasan na. Of course, the flow of the blood is not sufficient enough to maintain the turgidity or the ang tawag nito, yung pagpasok ng dugo doon sa penis, okay? It could be secondary to a nerve disorder, or it could be also due to stress and some relationship conflicts. Wala naman po nakikipag-sex na meron na, or nakipag-away na magaganahan po na makipag-sex po. And then of course, depression and performance anxiety. Now, sometimes it's actually performance driven. So sasabihin ng ng asawa, I mean, of course, it's normal to be talking about after an engagement, no, of a sexual intercourse. How's my performance? How is it? How would you like it the next? There are natural solutions that we can talk about, even if they don't have yet the erectile dysfunction. So pwede po, preventive, promotive, and protective at the same time. So what are the active ingredients? Okay, one is the TONGKAT ALI. Of course, constantly you've heard of this, okay, but definitely it has to do something with the testosterone. TONGKAT, testosterone, okay? It enhances the energy levels, endurance, and stamina. Okay, it's like in the fight mode, no? Kailangan talagang you can actually withstand the or endure all the pain, the punches, and all the blows. No? Apart from TONGKAT ALI, okay, you have your DONGKWAI. So this is both let me just remind you that TONGKAT ALI is not just for males, it actually is beneficial for both the female and the male. Now, DONGKWAI for gynecologic problems. Okay, so it's invigorating, it's tonic, okay, for both the men and the women, and it increases the effect of the hormones, both men and women, and also used as an aphrodisiac. So it heightens the sensation. Now, of course, pag aphrodisiac, mas yung desire is heightened also. Libido is increased. So for use for the treatment of the male factor infertility, and also it improves the sperm motility and morphology. No, yung morphology po na tinatawag, yung structure, the normal structure. Kasi may mga sperm cells po na walang ulo, meron po yung mga walang buntot, no? So it actually modifies them and tries to regenerate a normal looking and functioning sperm cells. We have the MUIRA puama, which is the Viagra of the Amazon. It heightens receptiveness to the sexual stimuli and sensation. Konting haplos lang, medyo talagang iba ang naging stimulation. Okay? Also, it increases the mental performance, medyo talaga, and the physical stamina. So, kaya ito yung mga medyo nakakapagpabago ng iyong tawag nito, plans, no? So parang nagkakaroon ka ng, okay, dati medyo gantong position lang, then you can actually be very active and very, tawag nito, creative, no? Nagiging creative, nakakapag-stimulate ng ating mga brain. So it helps with the mental, physical fatigue, irritability, and headache, no? So yan yung mga kagandahan ng MUIRA puama, because it heightens the sensation. Okay. Then of course, puncture vine. Okay, it mimics the effect of the testosterone in the humans. It promotes the release of the nitric oxide. So what does nitric oxide do? It actually dilates the blood vessel. So important for the blood circulation to flow into the blood vessel. Of course, you need all these blood vessels to be dilated po. Di ba po yung nasabi ko in one of my lecture, kapag halimbawa ang may boxing, so kinakailangan po yung iyong sympathetic would be also supplying the good blood supply to your kamao. Saffron is not just for cooking. So its important role is for the fertility and increasing libido also. So it's an aphrodisiac as well. It improves the sexual functions in men and women. Also for those who are having some major depression. But of course, you have to address the major depression first. So hindi ka naman gaganahan mag-sex kung kung ikaw ay depressed or something bad really happened, no? So you have to actually in a complete state of a good mood and good vibes, okay, when you will have to be doing that. We have the horny goat. Nako, medyo talagang horny ang nakalagay dito. Horny goat because it actually is, it prolongs the erection. So by blocking this substance that causes the organs to go limp. No? Kasi when you age also, the PDE5 also increases. So kaya minsan yung parang, okay, natapos ka, isang putok, tulog. So of course, then, hindi na yung kagaya doon nakakaya ng mga 5 hanggang 8, di ba? Hanggang 8 putok. Ganon na sinasabi. Of course, now this time, medyo nagkakaroon ng problema in terms of that to actually revitalize or regenerate it after, okay, a certain engagement. So, boost the transmission of the nitric oxide. It actually is a vasodilator. So, nagpapalaki pa rin siya ng ugat, ng daloy, ng dugo sa ugat. So it acts sa women as a phytoestrogen associated with decreased symptoms of menopause, including low libido and vaginal dryness. Of course, you have to rule out also these mga menopausal symptoms because definitely a lot of menopausal women doesn't want to engage into it because of a certain dryness of their vagina. And of course, some actually are not even lubricating. And also some would make it or would feel it difficult during the introitus, no, habang nagsisex po masakit. So you have to rule that out, okay? Definitely and definitely for all of us who are aging, we need to have the supplementation that is actually recommended. So it doesn't go back, okay? Not like some others now, of course, you have your glutathione that can be introduced by, okay, an exogenous one, inject lang, and then you can actually have all these glutathione back. No, this time, okay, it's not that something that will be replaced by just having, okay, allowing it, no? Parang babalik din yan anyways, may asim pa ako. It's not true. So, kailangan mo mag-supplement para bumalik ang asim mo. That's the reality. One is actually this anti-aging that we are introducing to you, ALTA ULTIMA. Okay, it certainly contains all the collagen that is needed, not just for the face, body, and also for the vulva, and also for the males as well. No, it keeps your skin strong and elastic, even in that vaginal area. It prevents the premature wrinkling, also even in that vulva area. Now, also your CoQ10, as mentioned, it depletes as we age. No, it actually has this CoQ10 that keeps your cells energized and maintained and repaired. Okay, so yung pine bark, it's actually the source for our HA. So it makes our cell or skin hydrated and moisturized. Okay, it prevents the wrinkling and premature aging. Okay, so maki berry, it's a good antioxidant. So it prevents the free radicals and cell death, and then from having oxidative stress and damage. And then, of course, it has TONGKAT ALI that relieves stress and anxiety. It boosts the stamina and the drive and increase the levels of free testosterone. Dong Quai for gynecological and fertility problems. It's also good aphrodisiac. MUIRA Puama is the Viagra. No, it actually makes it so engorged, intense, heighten its receptiveness to sexual stimuli and sensation of the sex. Of course, we have puncture vine for testosterone effects, including the drive and stamina. Crocus sativus, an aphrodisiac for libido and fertility. No? Of course, it has to be hand in hand. When you're fertile, of course, there has to be a sign that that you have an increased libido. Ang sayang naman kung you're fertile and you don't have the desire. No po? Improves sexual functioning in men and women, with also those that are having some major depression. And of course, there's also what we call as the Epimedium extract that acts as a natural phytoestrogen, plant estrogen in women associated with decreased symptoms of menopause, including low libido and vaginal dryness. Also, it helps in prolonging the erection in men. So you can go for seconds and thirds. And then, of course, it boosts your nitric oxide to make it actually engorge and dilated blood vessel. We have L-arginine, which is an amino acid that actually synthesizes the nitric oxide for the blood vessels to dilate. And then, of course, the recommended intake would be at 2 capsules upon waking up. Okay, so especially and normally I would suggest this if and when the males doesn't have any erection in the morning, and then of course they can actually be having this 2 cups upon awakening, because sometimes normally in the wee hours, notice yung sa may asawa po o yung mga mag-asawa, normally pag rested yung lalaki at walang erectile dysfunction, makikita mo or makakapa mo yung ari niya na okay, naka-flag ceremony yan. Okay, so tayong-tayo yan. Of course, pero pag wala ng mga ganon na nangyayari in the wee hours, of course, may problema, may erectile dysfunction, and definitely that person should be taking this. Okay, this ALTA ULTIMA. So 2 capsules upon waking up, and then 1 hour after lunch, and then 1 capsule before bedtime. Okay, so taken in cycles of 3 days. This is the recommendation. Okay, 3 days on, 3 days dire-diretso, and then on the 4th day, you have to take it off, meaning you're not going to take any. Okay, so, well, of course, it is actually cumulative. It's not something like magic that you will take in today, okay, then tayong-tayo na. Kung for those who never really had an erection, no? So, medyo cumulatively, okay, the first bottle will be definitely, you will feel the effect. Okay, but then of course, sustaining it, it's another thing, because you will have the sustainability, or reverting to its usual, or not really to ano bang sasabihin ko dito, it can go back to its normalcy, with constancy. So, kailangan po constant. It's not just one time and tapos bigla na lang laki haba. Walang ganun po. No? Walang ganun. So, you have to maintain, okay, for 2 to 3 months of this, and then thereafter, you have to sustain it and to see the progression. Okay. So, ang nakalagay po dito, of course, this is a disclaimer. It's not actually a medicine for those with real and overt problems of erection, especially those that are actually did not mention. So unless, of course, your urologist would say that na, okay, pwede ito, you can always just ask your urologist. But then, of course, for those who are actually promotive, preventive, then you may want to actually be not feeling those symptoms and complications of that, then you can start as early as when you are actually 30. So that I recommend. That's my recommendation. Okay, so that is my Alta Ultima for you. Okay.